Hello, and welcome to this comprehensive training session on AOD 9604, a peptide with significant potential in fat metabolism and tissue repair. During this session, we will explore its mechanism of action, clinical applications, dosage protocols, risks, benefits, alternatives, and patient considerations. Additionally, we will review 3 detailed clinical case studies and discuss recommended laboratory evaluations to ensure safe and effective use. Let's begin. AOD 9604 is a modified fragment of human growth hormone, HGH, specifically amino acids 176 or 191. It was designed to retain the fat-reducing properties of HGH without the associated side effects, such as impacting glucose metabolism or promoting cell proliferation. AOD 9604 is primarily used for its ability to enhance lipolysis, fat breakdown, and inhibit lipogenesis, fat formation. Additionally, recent studies have explored its potential in tissue repair and cartilage regeneration, making it a versatile therapeutic tool. AOD 9604 mimics the lipolytic region of human growth hormone, exerting its effects without interacting with growth hormone receptors. Its key mechanisms include fat metabolism, stimulates the breakdown of stored fat, lipolysis, while inhibiting the formation of new fat, lipogenesis, particularly in abdominal fat stores. Cartilage and tissue repair, enhances tissue repair processes by promoting cell growth and reducing inflammation, especially in cartilage and musculoskeletal structures. Metabolic balance. Unlike HGH, AOD 9604 does not significantly affect blood sugar or insulin levels, making it safer for individuals with metabolic conditions. These mechanisms make AOD 9604 a targeted therapy for fat loss and tissue regeneration without systemic hormonal effects. AOD 9604 has several clinical applications, including weight loss and fat reduction, effective for reducing stubborn fat stores, especially in the abdominal region. Metabolic syndrome, aids in weight management for individuals with insulin resistance or metabolic syndrome. Cartilage and joint repair, supports cartilage regeneration in patients with osteoarthritis or joint injuries. Post-surgical recovery, enhances tissue healing and reduces recovery time after orthopedic or musculoskeletal surgery. Body composition improvement, used in combination with exercise and diet to improve muscle-to-fat ratio. Anti-aging and longevity, supports overall metabolic health, aiding in age-related fat accumulation and joint deterioration. Benefits. The potential benefits of AOD 9604 include targeted fat reduction without affecting muscle mass or glucose metabolism, enhanced tissue repair and regeneration, particularly in cartilage and joints, improved body composition and metabolic health, safe profile with minimal systemic effects compared to full-length HGH, potential to reduce inflammation and improve recovery times in musculoskeletal conditions. Risks. AOD 9604 is generally well tolerated, but potential risks include mild side effects such as headache, nausea, or fatigue, rare injection site reactions including redness or swelling, hypothetical risks due to limited long-term human studies. These side effects are typically mild and resolve without intervention. Alternatives. Alternatives to AOD 9604 for fat reduction and tissue repair include, for fat reduction, L-carnitine, lipotropic injections or medications like semaglutide. For cartilage repair, platelet-rich plasma, PRP, or hyaluronic acid injections. For weight loss, lifestyle interventions such as caloric restriction and exercise, combined with medications like phentermine or liraglutide. For tissue healing, peptides such as BPC 157 or TB500. AOD 9604 is administered via subcutaneous injection. For fat reduction, dose 200 to 300 micrograms administered subcutaneously daily, typically in the morning. For cartilage or tissue repair, dose 250 to 500 micrograms administered subcutaneously daily or every other day. For post-surgical recovery, dose 300 to 500 micrograms administered subcutaneously daily for 4 to 6 weeks. Treatment duration, protocols range from 4 to 12 weeks, depending on the clinical goal and patient response. Long-term use may require periodic reassessment. While AOD 9604 does not directly impact systemic hormone levels, laboratory testing is recommended to ensure overall health and monitor progress. Baseline testing, comprehensive metabolic panel, CMP, to assess overall metabolic health. Lipid profile and body composition measurements for baseline assessment. Markers of inflammation, for example, CRP-ESR, if used for tissue repair. Monitoring. During treatment, periodic weight and body fat percentage measurements. Patient-reported outcomes on joint or tissue pain for repair-focused protocols. Post-treatment evaluation, repeat metabolic and body composition assessments to evaluate treatment efficacy. Imaging, for example, MRI or ultrasound, for patients undergoing cartilage or tissue repair. Case study. 1. Abdominal fat reduction in metabolic syndrome. A 45-year-old male with metabolic syndrome presents with stubborn abdominal fat despite lifestyle interventions. Treatment protocol: AOD 9604, 300 micrograms subcutaneously daily for 12 weeks. Outcome: reduced abdominal fat by 15% and improved metabolic markers, including triglycerides and fasting glucose, by the end of treatment. Case study 2. Cartilage repair and osteoarthritis. A 55-year-old female with moderate osteoarthritis of the knee seeks non-surgical options to improve joint function and reduce pain. Treatment protocol: AOD 9604, 400 micrograms subcutaneously daily for 8 weeks. Outcome: significant reduction in knee pain and improved joint mobility, confirmed by ultrasound evidence of cartilage regeneration by week 8. Case study 3. Post-surgical recovery after ACL reconstruction. A 30-year-old athlete recovering from anterior cruciate ligament, ACL. Reconstruction seeks to accelerate healing and return to training. Treatment protocol: AOD 9604, 500 micrograms subcutaneously daily for 6 weeks. Outcome: faster recovery of range of motion and strength compared to typical rehabilitation timelines, with no adverse effects reported. In conclusion, AOD 9604 is a safe and versatile peptide therapy with applications in targeted fat reduction, tissue repair, and metabolic health. Its ability to mimic the fat-burning properties of human growth hormone without systemic side effects makes it a promising option for patients seeking non-invasive treatments. With proper patient selection, monitoring, and individualized dosing, AOD 9604 can improve outcomes in both aesthetic and functional health settings. Want to introduce